Hello, I'm Dr. Hodkin. In this video, I'll talk about a procedure known as a Yag Capsulotomy. I assume you are here because you've had cataract surgery in the past and now your vision has become blurry again. To help you understand, I will first review a little bit about the anatomy of the eye. I think this is best explained by following a light beam as it travels through your eye. The light enters the clear front surface of the eye called the cornea, which does most of the focusing. It then passes through the central opening in the colored part of the eye called the pupil, which controls the amount of light entering the eye. The pupil is dilated with drops before doing eye surgery. It then goes through the lens of the eye, which, along with the cornea, helps to focus the light. When the lens becomes cloudy with age, it is known as a cataract. Light then passes through the center part of the eye, which contains a jelly-like substance known as vitreous. If you have floaters in your vision, this is caused from particles suspended in this area. Finally, light ends up focused on the back of the eye onto the light-sensitive retina. The bullseye center of the retina is called the macula, and this is where the condition known as macular degeneration can occur. Now, if we take a closer look at the lens, it is wrapped by a clear thin membrane known as the capsule. It's kind of like a sandwich within a baggie. Now, when we are born, the lens and capsule are clear like glass. With age, however, the lens becomes discolored, kind of a yellowish brown, and makes your vision blurry. This is what was removed when you had cataract surgery. To remove your cataract, a circular opening was made in the front of the capsule and a lens implant was placed in the same space. So the lens implant is sitting in the same capsule which once held your cataract. So even though the capsule is open in the front part of the lens implant, it is completely covering the back surface of the implant. Now, at the time of cataract surgery, the capsule is usually clear, but in time the capsule can become cloudy, kind of like wax paper, due to natural healing. This happens to about 1/3 to 1/2 of all patients who have cataract surgery and usually occurs months to years later. Actually, in some cases, the capsule can be cloudy from the very start, depending on the type of cataract. To you, it may seem like you're getting a cataract all over again because you're looking through this cloudy film. It is this back surface of the capsule that is the target of the laser procedure that I'll describe. The Yag laser capsulotomy procedure is a quick, painless, insurance-covered outpatient procedure which opens the cloudy capsule that lines the back of your lens implant. You don't need to go to the operating room. You just sit at a slit lamp that has a laser attached to it, similar to the one that's used to examine your eyes. We use drops to numb and dilate the eye we're going to work on, and the procedure itself takes 5 to 10 minutes. We may or may not put a lens on your eye during the procedure, depending on the view, though usually I do a no-touch technique. You will hear clicks as the laser fires, and it may take several dozen to several hundred shots to fully open the capsule. This is because some capsules are much thicker than others. After the procedure, we will check your eye pressure about a half hour later, and then you are free to go home. Since you are not sedated for this, you can drive yourself to the appointment as long as you realize that one eye will be dilated and be light sensitive. Wearing sunglasses can help with this, especially when driving. There are usually no drops to use after surgery, and you'll notice improved vision after your dilation wears off in about a day. If the other eye needs treatment, this can be scheduled for a future date. In other words, we don't perform laser surgery on both eyes at the same time. The procedure usually does not change your glasses prescription much, but it may pay to visit your glasses doctor in the near future to make sure you have the best possible prescription. Although the procedure is very quick, you'll be in the building several hours since it takes time to check in, fill out the paperwork, get dilated, and check out. To be more efficient for everyone involved, we will usually group you with other patients who are having the same procedure. The most common risk from a Yag capsulotomy is an elevated eye pressure right after the procedure. This is why we check your eye pressure about a half hour after completion of the laser. If the pressure does go up, we treat it with pressure-lowering eye drops. It's also common to see more floaters after the laser. Just like generating sawdust when you cut wood, the laser generates debris as it opens the capsule. These floaters tend to settle down to the bottom of the eye with time and gravity, but some may persist. If the surface of your eye is more fragile than usual, and especially if we put a lens on your eye to do the procedure, you may rarely get a small corneal scratch on the surface of your eye, which may take several days to heal. Although a scratch can be very uncomfortable, it usually heals with no consequence. Other very rare risks include a retinal detachment or even a lens implant which moves out of its position in the capsule, which would require additional surgery. The risk of these is less than 1 in 1,000. If you do have any sudden decreases in your vision after the procedure, please call the emergency number right away. Overall, I think you'll find this procedure quite easy and painless, and will be very happy with your improved vision. Please ask any questions you may still have during your exam. Thanks for your time and attention.